Hello, everyone, and welcome to this Women Mobilize Women webinar series on the intersection of gender and mobility. This is part one of a two-part episode focusing on age. We know that the intersection of identities and experiences produces different perspectives of mobility for everyone. As a result, a gender-sensitive approach to the mobility transition will go beyond one's identified gender and include factors like age, socioeconomic access, ability, and geographic location, among other things. And so our hope is with this webinar series, we can discuss some of those with experts in the field, their experiences, both on the work and professional side, but also individual experiences, and how we can bring this knowledge together to work towards a more just and equitable mobility transition. What you're about to watch is a pre-recording that was done in September of 2024 of our guests for our old age episode. Unfortunately, when we had the launch of our event with the live questions and answers on the 8th of October, we had a technical glitch, and so that recording is not available. However, we felt the conversation was so important to share in terms of understanding the experiences of older adults and what we can do as professionals to make their transition in mobility much more smooth and equitable and comfortable. And so we wanted to make sure that you had the opportunity to see that original conversation. That conversation also had a couple of technical glitches, but we feel that the value of what was said and what was shared was, again, too important not to hear. And so we hope you enjoy the episode. Be sure to follow up and see part two, which is focused on the youth experience. And if you have any questions, please put it in the comments below or reach out to us individually. Thank you and enjoy. So much in the same way that society can be binary about gender, so too can it when it comes to age. So data and planning often think of mobility users within the age frame of adults between the age of 25 and 65, and this overlooks the fact that how we move in public space and our transport needs will change over the entirety of our lifetime. In part one of this two-part episode, we will discuss how these needs for the experiences of older adults, particularly older women, influence their mobility choices or lack thereof from the Latin American perspective. So we're going to begin with the presentation of the master's research of Camila Barquero, a researcher for the Global Network for Popular Transport, about the needs and experiences of older adults in Costa Rica. And then we'll follow that with a discussion together with Carla Quesada, coordinator for Gender and Inclusive Cities in San Jose, Costa Rica, and Dr. Eveline Trevisan, sustainable mobility expert from Belo, Horizonte, Brazil. So with that, I'm going to hand it over to Camila to start us off with sharing her research.
Perfect. Thank you very much for that introduction. Now I'll share my screen. Perfect. So, hello everyone. My name is Camila Barquero, and I'm happy to present with you today my master's thesis titled Towards Inclusive Urban Planning, addressing accessibility poverty among older adults through proximity-centered accessibility in the city of Curridabat, Costa Rica. And let us get started by the fact that today around 700 million people worldwide are aged 65 years or older. By 2015, this number will rise to 1.5 billion, making up 16% of the global population. This demographic shift represents, of course, an induced demand for cities that support healthy aging. Now, considering the proximity-centered accessibility with examples such as the 15-minute city aims to improve local access to basic needs, it is possible to induce that this planning paradigm supports healthy aging. However, this concept has raised criticisms for not being inclusive. For instance, Wilberg et al. Point out that it often fails to consider diverse demographic and socioeconomic groups. Other researchers, such as Silva and Cavarin et al., have argued that the 15-minute city fails to consider differing abilities between older and younger individuals. And of course, last but not least, we have Guzman et al., who point out that this concept's potential is more difficult to achieve in contexts where spatial segregation and social exclusion are features of daily life, such as it is the case in developing cities. Therefore, I asked the question, how can proximity-centered accessibility address accessibility poverty among older adults in Curridabat, Costa Rica. And first, what is accessibility poverty? And therefore, I proposed a definition in a framework based on literature that says that it is a condition of social exclusion that arises from the difficulty of reaching essential services independently within a reasonable time, with ease, and at affordable cost. This condition results from barriers related to transportation, land use, governance, temporal, and individual circumstances. And now, why Curridabat? Well, as we see, the city is located in Costa Rica's Central Valley, and it has a higher share of older adults than the average of the country. Also, it is part of the program for healthy aging of the World Health Organization and has as well a municipality known for its responsiveness to research. And having said that, I would like to jump now to the methodology of results of the research. And the first part I wanted to look at was the discrepancy between the current and the ideal travel time to different amenities older adults have. And to do so, in a workshop, older adults mapped their home locations and then using OpenStreetMap and QGIS, I calculated the shortest route to many amenities using also the walking speed specific for an older adult of 1.3 meters per second. And after conducting the calculation for every amenity, I could know what was the minimal time to each amenity for each of the older adults that participated in the workshop. That was for the current travel time. So how was it the ideal travel time for each of those people that participated in the workshop? And to do so, I used a tool called Flowers of Proximity, which you can see here on this picture. It looks like a flower where each petal represents an urban function. For instance, salud, which means health. We also have another petal for education, for entertainment, for living, for work, and for commerce. And we have different radii representing each a different time threshold. For instance, 5 minutes, 15 minutes, and 30 minutes. And then older adults could place amenities, which are depending on the urban function and are listed here, amenities within each of the radius, and tell so in which ideal distance they would like to have, for instance, a playground. This person wanted to have a playground within 5 minutes of walking time from their home location. And doing so with all the different workshop participants, I could represent and these flowers the discrepancy between ideal and current travel time. Here on the left side, we see Granadilla district, and with red, we see the current, and with blue, we see the ideal travel time. We see that the current travel time surpasses almost all, it surpassed by in almost all the amenities, with exception of schools, doctors, and workplace. So we see that these people really cherish the proximity to many amenities. On the other side, we have in the central district the opposite situation. So we can see that the ideal, which is represented in orange, is way greater than the current travel time. And this is the case for many of the urban functions. Interesting in this case is that the participants for Granadilla, which lived in a rather informal urban setting, really desire proximity to many services, whereas the participants from the central district, which all live pretty central and have a mix of functions nearby, wanted to travel longer to reach those amenities. So that was very interesting to see that discrepancy depending on where you ask this question. Looking forward and looking at the situation on the ground, which looked, for instance, in Granadilla, like this, and talking with the people in the workshops, and also analyzing their visions, I could also see that we cannot see accessibility just from the perspective of proximity and travel time. We need to look further. And therefore, I developed so-called personas, which all represent groups of older adults facing similar challenges. And they include barriers not only from the land use perspective, but also from individual, temporal, and transport perspective. And I place them in a fictive ideal city of proximity to see how their barriers could be potentially addressed. And just as an example, here you can see Elena. She's 81 years old. She usually walks to reach her destinations. She's Costa Rican and low income and lives in Granadilla. She suffers from Parkinson's disease, which difficults her walking, and loves spending time with the family. What are her barriers? Well, she cannot visit her daughter in the neighboring town due to the lack of bus services. Additionally, before turning 65, she found ticket prices challenging. At 65, people usually get a discounted fare ticket. She's afraid of crossing the streets, and streets usually disgust her due to dog feces and trash. Moreover, she cannot walk on the sidewalks because cars block them. Also, she would never go out at night. In an ideal city of proximities, she would have a better interconnectivity due to better public transport networks. The municipality would prioritize pedestrian mobility over parking for cars, and she would feel more safe due to better lighting at night. On the other hand, we have Antonio, who usually drives a car, and he really cherishes being active and independent. He fears the idea of not being able to drive his car, and at the same time, traffic causes him stress. Sometimes he drives by bus, but bus drivers have bullied him for using his discount card. And he feels alone because he lives in a very individualistic neighborhood. And in an ideal city of proximities, having nearby shops would reduce his need to drive, preserving his independence and reduce traffic-related stress. And he could also have places to meet within walking distance, which would reinforce his sense of community. We also have one other case, the last one, which is Ana. She's Nicaraguan and low income and live in a district called Terrazas, which has a more informal like origin, and she cannot read and suffers from spine pain. She cannot use the discount card due to lacking papers. If she had them, like she sells clothes normally, if she had them, she could sell clothes in other districts as well. And she struggles with the absence of pharmacies, supermarkets, and church. Also, she has to take more than 30 steps to reach her home. So, in the ideal city of proximities, she would need to travel less by bus, reducing the financial concerns, and she could also plan her journey better because bus stations would have announcements, which would make her move independently. Also, having a pharmacy nearby would lessen her health burdens. So, to answer your question, how can proximity centered accessibility address accessibility poverty? Well, of course, proximity improves participation and access to essential services. However, simply reducing distances is not sufficient as it does not address barriers caused by poor built environment. Second, it provides easier access to services by active mode, and that way it addresses barriers caused by affordability and reduces physical effort. And as well, accessibility poverty during night hours can be addressed by enhancing the perception of security with more vivid surroundings. In the recommendations, I think focusing on areas with higher accessibility poverty would be very valuable. Also, promoting mixed use land functions and applying fare reductions based on age and not, for instance, on migratory status. And thanks to the people I could talk to throughout the research, it was possible to see that proximity is essential to being independent at an older age. However, we need a handful of different actions to really achieve this goal. And I hope this presentation gave you a bit of food for thought. And now, having just touched a bit the surface with all the different dimensions we have to consider, I would like to return to Melissa, and I'm looking forward to the panel discussion. Thank you very much.
Thank you, Camila. It was very interesting, and I think it highlights the importance of understanding, even if we're just looking at older adults or older women more specifically, their diversity of needs just within that demographic within Costa Rica or in the city that you focused on is so different that we need to also take this very intersectional approach. So I appreciate you sharing your research. I think where the question I would like to start with, you have touched on the idea of proximity, but I think a more overarching place to start with maybe be to understand, or what do we misunderstand rather, about the needs and experiences of older adults and older women in mobility from your respective perspectives. So Eveline, can I start with you from maybe the cycling perspective?
Okay.
Mhm.
Okay, cannot address this issue without mentioning that my response is based on my experience with cyclists. But when discussing a mode of transportation historically excluded from cities, we end up observing other marginalized groups, such as people of different genders, children, older adults, and those with limited mobility. My experience with cyclists helps me for older adults, I think. So for me, a common mistake in urban mobility is disregarding the walking speed of older adults. Cities are generally designed for young, white, middle, or upper class men. Therefore, the main error for me is not taking into account the slower pace of older adults when designing urban space. I think that's it. It's okay.
Yep. Yeah, you're a little bit choppy, but that's okay. We can carry on. You're here.
Okay. Okay. Thank you.
And Carla, for you and your research, what do you think is important to understand around the mobility of older adults?
Yeah, I think for me it's a bigger issue. Like Camila already mentioned a couple of examples in Costa Rica, but for me there's a cultural aspect that we need to address. That is the fact that sometimes there's a misunderstanding that aging means that you don't want to be as involved in public life, or you don't want to be as involved or engaged in activities. No, so there's this perception that people have less energy, less intention, less needs, and that's one of the reasons. And also related to the fact, or some of the things that Camila mentioned before, there's this mix of a misperception that the older adults or the elder population, they have less needs, and also a mix of an infrastructure that is lacking the proper conditions for them to be part of life. So these combinations sometimes end up being like people are there stuck in their houses, and we think it's just part of their energy levels and the way they want to live, no? So for me, one of the first things that we need to address as a country, or as countries in general, is the fact that aging doesn't mean that we don't want to be involved in the public life, and that we don't have needs, and that we don't want to be autonomous, and that we don't want to do things, no? Because that for me is a key aspect of how to widen our perception of this population in specific. And sometimes even like, for example, something that is related to like older women is the fact that they still have care roles, no? And that we still assign them the care of the grandsons, granddaughters, etc. And that means that we're also relying on them like one of the main roles in our society, but we're not giving them the proper conditions for them to be also like providing this work, because it is a type of work, no? So for me, that's two things that we need to address. First, our perception of aging as something that means that we stop living, and also second, like giving them the proper conditions to be autonomous and to decide for their own lives, because the needs are still over there. So in Costa Rica, I think we see this a lot, and also we have this misperception, and we need also to demystify this. We have this perception that what we have is enough, when it's actually not enough. And Camila did these participatory processes, and we've been working with different populations. And what we see in every single one of the processes is that the infrastructure that we have right now is lacking of the conditions for certain historically vulnerable populations to be part of an active society. So for me, it goes to the root of how we perceive aging.
Thank you. Camila, just building on that and then tying it into a question of proximity. You mentioned with one of your profiles a gentleman that would be quite sad to lose access to his car. And I think there's a lot of perceptions when people are planning for cities that there's this dependence that we carry on having, or access to motor vehicles. If we contrast that to, for example, Anna in the informal environment or informal housing situation, how do you think that we can help, even if it's from just the Latin American perspective in Costa Rica, where you studied, or more broadly, or in the larger global South? How do you think we can help planners better understand, for example, in more informal environments, that dependency and access to car is very different from someone in a central district?
That's a very good question. And I think the answer here is just equity and how you define who your target population is. Because in my research, I think it was very interesting to see the differences between socioeconomic groups within the same age group, because not all the older adults had the same opportunities and needs neither. So one option to really cater all the needs from the most vulnerable population would be to identify, for instance, using even just a simple tool as the discrepancy of ideal and current accessibility. It's very easy, but there you can see where needs are fulfilled and where we have a big potential for improvement. So in this case, um, like based on my research, just for instance, it would make more sense to start focusing first on areas where we see that the discrepancy is bigger, because otherwise we would just tackle the needs of individuals that already are placed in a situation where they can overcome barriers more easily due to their socioeconomic status. For instance, they do not need to be afraid of crossing the street because they can reach their destinations by car. Whereas, on the other hand, not so far away from where they are, we have individuals where they cannot even travel by bus because they cannot access them due to affordability issues. And there, they would need to actually um, go longer distances to even for fulfill the most basic needs. So I would suggest for planners to go first and identify which areas are the most vulnerable ones and where do we have more people that are more vulnerable, and start looking there what specifically do the people need. Because as we see that the solutions are multidimensional, and therefore actually also the solutions will need a an interdependent work between different administration departments and so on. So I think that would answer the question, and I hope maybe you have other questions following that one.
Well, I think I'm going to then shoot that over to Eveline in terms of, moving around by cycles, because I think one of the things you touched quite well, Camila, is in terms of walking and public transport or popular transport. But then from cycling, how can we use this information to facilitate older adults having access?
Okay. Okay. I think by providing sustainable mobility infrastructure for other adults, such as in general, people who currently rely on individual transportation to opt for more accessible alternatives. Even other adults, for example, who do not face serious mobility limitations and are more active, they benefit from a safe and attractive transport system. In Brazil, many older adults do not have end up staying at home. So it is essential to provide sustainable mobility infrastructure that facilitated their inclusions.
Yeah.
Okay.
Mm-hmm. And Carla, in your research as well, with the work that you're doing, how have you, understanding the idea of access for sustainable choices or popular public transportation, how does proximity filter into the work that you do in terms of better facilitating access for everybody, but particularly for older adults?
Yeah, of course. I think one of the key things that we have done through the projects is having conversations, just like Camila already mentioned, just to understand the needs of these populations, not just based on what we think are their needs, also and based on the needs that they manifest. And also, like once we identify those needs, it's a key to plan mobility, and it has to do with proximity, of course, because we create or we try to plan or to propose how to connect those things so they can feel active members of society, but also how they have certain autonomy, no? Because one of the key findings of our research is that because of the challenges that we already mentioned about public transportation, or Camila mentioned in public transportation, related to payment, related to rejection in the public system, related to the lack of active mobility infrastructure that it's accessible for people. So most people, or some people, they end up having to be stuck in their homes, and there's this concept that they have developed, no, the unwanted solitude, no, that as we age, we have fewer connections with other people, and we also have if we don't have access to other activities, we don't strengthen those relationships with other people, we don't create connections, no. So unwanted solitude is a key aspect to tackle, considering that it affects health in a wider aspect, no. And one thing that we've been trying to do, for example, in our nonprofit organization, one thing that we suggested to certain local governments that has to do to planning and proximity is how can we do certain things that we are calling right now circuitos de caminabilidad, that translate as walkability circuits, that has to how to improve, because we know that it's also an investment. It's money, it's time, it's planning, and we know that it's expensive, no? So what we've been trying to suggest is that you can start connecting these very important key elements in people's, in the, for example, in the older adults population, like pharmacies, clinics, churches, because Costa Rican populations used to like are very Catholic, things that are important for adults. We can create certain circuits that they can walk around, so they can also be autonomous and independent, and they can do whatever they need without depend on other adults in their lives, because that also creates like certain tension in families as well. And also they take away the right or the feeling that they can do whatever they need whenever they want, no. So that's some of the things that we've been trying to propose in proximity and planning, so we can connect people with whatever they need whenever they want.
Thanks. And then going back to you, Eveline. So tying on to what Carla is saying, and then as she mentioned, or as you mentioned earlier, Carla, around how even older women are still doing a lot of work around care. How can we better plan our cities, particularly for older women, or what can we do around policies as well that can help to ensure that even women as they age who are still responsible for care or just navigating the city on their own, how we can make that easier for them?
Okay. Okay, I think it's crucial to consider the walking speed of other adults when planning urban mobility. We need to rethink city planning from the perspective of walking speed, not motor vehicle vehicle speed. Thinking mobility changed the approach to urban planning. Instead of designing the city with a focus on a traffic flow, we should prioritize the pedestrians' experience. In my city, for example, we have to cross some streets in two phases. It is essential to ensure that crossings are continuous and safe for pedestrians. And this idea that pedestrians hinder vehicle traffic must be changed. Those who are not protected by a vehicle should have priority and safety in their movement. Okay?
Mm-hmm. And Camila, and then with your research, yeah, if you have anything to add, go ahead. I won't even ask the question.
I think for in that aspect is perceived safety, especially for women, at least in my experience, a very important aspect to consider in policies. And what that is that older women, at least in my research, were afraid of groups of men and of walking alone in parks because they saw that younger men were grouped. So I think there we should see where and when do older women feel um, afraid and what hinders their participation, for instance, during night hours, because some of them expressed a really great desire for walking at night, for instance, but they would never, like, it is unimaginable for them to walk at night. So, in that sense, we see that there are barriers that are not even 100% related to the urban structure and not even 100% related to traffic flows, for instance, but also to how they feel. And also, when do they feel like that? Because it can be that during night they feel way worse than during the daytime. So, those are things that we should also consider when planning for them.
Mm-hmm. I think just pulling a little bit further with that question, and I'll go to you, Carla. I'm thinking of sort of Central American cities or cities that are more equatorial. You know, if you think about nighttime starts at 7:30, 8 o'clock at night. And I know when we're speaking about older adults, we're speaking about potentially women that are not, and older men as well, who are not working anymore. But that does start to really limit the mobility within the daytime hours if there's this perceived perception or if there's this perception of lack of safety. How can policymakers better adopt or adapt their cities to address that? How do you think?
See, I think there's okay, I just wrote certain things I want to share. So thinking about, yes, how do we engage like the older population and through policies? I think we were talking about care mobility, or care, like care roles that elderly women take care of. No, I was thinking about all of this discussion all around the world about care policies, and how one very good example is, I don't know if it's in the Netherlands or if it's in Germany, that they're paying people that they're taking care of other people, like older populations that they're in charge of taking care of their grandsons or granddaughters. They're giving actually them a payment. So that thing is actually a very fair way of addressing this, because it also helps in autonomy. So I was also thinking that while we work in this co-responsibility of care, that's where we should be aiming to, not keep on giving women the care labor, just like thinking about how as a society we can distribute a care. So that might be a way to address it. And also one thing related to what you were mentioning about the amount of time that we have to do, or that older people have uh, to do the things that they want to do. I think there's a conversation missing with the public transportation sector about schedules where they serve or they give services. Because, for example, in Costa Rica, during valley hours where there's not a lot of people moving around, there's less services. And I think that's first a thing that we need to tackle, so we can give people the options to move around, not just in the productive moments of the day, also in the other hours that there's other populations that they're as important, moving around. And also there's a need for a sensibilization process in providers of services that has also to do with policies, because it means that we have to create capacities in the sector to understand what this population is important, and to create empathy toward these users, no? And also, I think there's well, in Costa Rica, we already have a law that is related to active mobility that has to do with sidewalks. And I think that's a key element, because that's the connection, no, between the bus and the house. There's a lot of active mobility that we need to do. And if we don't have the proper infrastructure, there's no way, like, people in general can move around, but people with certain mobility limits, they are going to be more in risk of having injuries, and not trying, like, not even thinking about participating in the public life because they don't have the proper conditions. So for me, all of this has to do also with inclusive design standards and policies that from the government and the local governments you can push. So all of the things that we're designing, parks, sidewalks, public transportation, everything has a minimum of standards and a minimum of things related to accessibility that we can think of to create a better society for everyone, especially for more vulnerable populations, just like the older adults that we have in our communities.
And Eveline, I'm going to come back to you. And my question, I think, is specifically related to that idea of making sure we provide enough solutions that allow for access to mobility, and an empathy towards how people move. In a lot of places, we see cycling policy as a way to help seniors, older adults, stay active longer. How in your work are you helping to adjust policy or design to help for those older adults that do continue cycling to be comfortable, but then also maybe providing training for older adults that maybe are not as comfortable cycling but would like to, in terms of maintaining access to a sustainable choice? I think Eveline froze. Oh, okay. You're back. You're good.
We need, including my internet is not good, but okay.
You're good.
Okay, I continue. Okay. Well, I think we need cities with universal accessibility, including accessible transportation and sidewalks in line with universal access guidelines. Considering walking speed in urban planning will allow adjustments in traffic line time, such as reducing the speed limits on the street. This way, I believe that we will be able to achieve a more respectful city for other adults and other people.
Wonderful. All right. Well, this has been a great conversation, and I'm sure that we could carry on talking. I think one of the key points from one of a previous episode that we recorded on disability made this great point that when we're designing cities, we need to be thinking about also future-proofing for ourselves, because we all get old. And eventually we will need other ways of being able to access. And so I think this scratches the surface of the conversation, and I hope we can keep it going. And for those watching, I hope they keep researching or ask our experts what other advice they might have in ways that we can help and what tactics are available. Are there any last points that anyone would like to make before we finish up for today? No? Okay. Then with that, thank you, everyone. Carla, did you want to say something? Sorry.
No, I think you made a perfect clear point. No, when we're planning for aging, we're planning for ourselves, and we're also planning for a wider population. So for me, that's part, and that's a key aspect of a just society, and that's what we want. And considering the bigger challenges that we're facing as humanity right now related to climate change, I think that's an intersection that we need to start doing, thinking about the societies of the future and how are we gonna be older populations in a couple of years, and what we want to think of our cities and how they look and what we want to experience in our last years in this earth.
Thank you. I think that's a beautiful note to end it on. So we'll hopefully get some questions from the audience in the next phase of this webinar. And thank you, Carla, Camila, and Eveline for joining us. And thank you for sharing your knowledge.
Thank you for the opportunity. Thank you.